number is 61 and our topic is hyperthyroidism from endocrine system. Patient name Mrs. Amelia Wilkins, age 43 years, sex female, occupation marketing executive. Background history. Amelia was brought to the clinic by her daughter due to her recent onset of palpitations, excessive sweating, rapid heart rate, increased temperature and insomnia. She was generally well until approx 2 months prior to this visit. During the previous 2 months, she had noted palpitations, shakiness of hands, muscle weakness and heat intolerance. She had been extremely nervous and fatigued. Her appetite and food intake had increased, yet she had lost 6 kilos. Past medical history, type 2 diabetes, otherwise looks relatively healthy. Past surgical history, none. Family history, mother had Graves' disease and was treated with thyroid surgery. Social history, divorced, lives with her daughter who works full-time and she smokes 1 pack of cigarette per day. Current medication, metformin 500 mg twice a day. Allergies, none. Clinical manifestations, palpitation, heat intolerance, fine tremor of hands, increased heart rate, sweating, nervousness and progressive weight loss. Vital signs, temperature was 38.4 degrees centigrade, heart rate is 110 beats per minute, respiration 18 per minute, BP 130 by 70 mm of Hg. Physical examination. An eye examination showed bilateral stare and lid lag but no proptosis and eye movements were normal. The thyroid gland was diffusely enlarged to at least twice normal size without nodules or tenderness. The heart showed a regular rhythm at 110 beats per minute with increased heart tones but no murmur or rub. There was marked fine tremor of the outstretched upper extremities.
Pathophysiology of hyperthyroidism. Hyperthyroidism is hyperactivity of thyroid gland with increased synthesis and release of thyroid hormone into bloodstream. The secretion of thyroid hormone is regulated by hormone from pituitary gland called thyroid stimulating hormone. Thyrotoxicosis is a result of hyperthyroidism, generally referring to high concentration of thyroid hormones circulating in blood, reaching cells in our body and result in the increase of basal metabolism. Thyrotoxicosis occurs when thyroid gland is excessively stimulated by trophic hormones, and also thyrotoxicosis occurs when thyroid hormone synthesis and the secretion is essentially activated, and also when there is passive release of stored hormone due to an autoimmune disorder, infection, chemical or mechanical insult, and the thyrotoxicosis also occurs when there is thyroid cancer. The first cause I'm going to discuss is Graves' disease. Graves' disease is the common cause of hyperthyroidism in Australia, which is of unknown cause and associated with precipitating factors such as insufficient iron supply, infection, and a stressful life. An autoimmune disorder in which own body immune system mistakenly attacks own cell of thyroid gland mostly affects individuals who are genetically predisposed. As well as Graves' disease causes an enlargement of thyroid gland, which is commonly termed as thyroid hyperplasia. Graves' disease increases the production of TSH receptor antibodies. This receptor mimics the action of TSH and promotes the growth of gland. In Graves' disease, thyroid gland loses ability to respond to normal pituitary gland secretion. Without any stimulation from TSH, thyroid gland itself secretes and releases uncontrolled amount of T3 and T4. In Graves' disease, tissues around eyes become inflamed, swells, and or bulging of eyes are the common symptoms of Graves' disease. The second cause of hyperthyroidism is thyroiditis. Thyroiditis is a condition of hyperthyroidism due to inflammation of thyroid gland as a result of microbial infection. Due to the inflammation, thyroid tissue releases perform hormone into blood circulation. It is characterized by fever and thyroid pain. The third cause of hyperthyroidism is toxic multinuclear goiter. Goiter is an abnormal arrangement of thyroid gland. It is a multiple growth of nodule resulting in enlargement of the gland. From this multiple nodule, one of the nodule become autonomous or cannot be controlled by the negative feedback mechanism from pituitary gland and result in excessive production of T3 and T4 on its own initiation. The fourth cause of hyperthyroidism will be abnormal secretion of TSH. This is due to disorder in pituitary gland. Overproduction of TSH activates thyroid gland to secrete excess thyroid hormone into bloodstream, resulting into hyperthyroidism.
Moving on to nursing intervention in regard to Amelia. First nursing intervention is improving nutritional status. Thyroid has intense impact on metabolism. Unintentional weight loss is common in hypothyroidism and it can be overwhelming challenge to rectify. Especially hypothyroidism patients with the risk of diabetes and cardiovascular disease are more complaining about weight loss. In 2012, Harris mentioned studies showed that half of the people with thyroid disease are undiagnosed and weight changes are the common symptoms for them. In relation to Amelia, in spite of increased appetite and food intake, she lost 6 kilograms in last 2 months. Nurse can educate and encourage her to take high kilojoule, high protein foods. Further, in 2012, Harris mentioned the biggest factors that help the weight loss are calorie and carbohydrate controlled meal plans. Nurse can advise Amelia to take appropriate portions of more emphasized diet with more vegetables, lean protein, fruits, healthy fats and high fiber foods. Hypothyroidism, particularly Graves' disease, is known to cause bone loss, which is compounded by the vitamin D deficiency commonly found in people with hyperthyroidism. Nurses can advise Amelia to take adequate bone-building nutrients such as vitamin D during and after treatments. On top of it, nurses can educate sources of vitamin D such as fatty fish, milk, dairy, eggs and mushrooms, and sunlight also a potential source of vitamin D. Further, coffee lowers the absorption of thyroid medication, so nurses should advise Amelia if she wants to have coffee at least take 1 hour apart from the medication. Rapid movement of food through the gastrointestinal tract will result in weight loss and nutritional imbalance. To overcome that, nurses can advise Amelia not to use highly seasoned food and stimulants such as coffee, tea, cola and alcohol. Finally, nurses can help Amelia to find out a dietitian to manage her diet. Dietitians have a thorough understanding of the metabolic changes with the hypothyroidism and diabetes. They can set realistic goals for healthy changes and regular exercises when counseling their clients. Moreover, it is common for patients with Graves' disease to experience periods of low and high thyroid hormone levels, and it takes several months to achieve the balance. It is vital to educate patients to focus on healthy behaviors such as eating nutritional foods, exercising regularly, managing stress and sleep adequately. Second intervention is improving sleep pattern. Patients with hypothyroidism, anxiety and sleep disturbances are common. To improve sleep, nurse can educate and introduce non-pharmacological method to the patient, such as preparing environment, exercise, avoid overstimulation before bed. In relation to the Amelia, she is experiencing insomnia. Nurse can advise Amelia to evaluate sleeping environment and remove anything that might distract from sleep, such as TV, computers, cell phones, clock with bright display. Nurses can ask Amelia to take warm bath before bed to get good sleep. Nurses can ask Amelia to set a consistent exercise pattern during the day or late afternoon, which can regulate body temperature and reduce anxiety. In addition to that, nurses need to educate Amelia to avoid exercising within 3 hours of scheduled bedtime because an increase in heart rate will keep her awake. Moreover, in 2012, Harris mentioned a study of patients with Graves' disease found that a structured exercise program showed dramatic improvement in fatigue levels, and significantly more patients were able to successfully stop taking antithyroid medications without a relapse. Nurses can advise Amelia if she is feeling fatigued and unable to do exercise, ask her to attend a gentle yoga class as a start to exercise. Further, nurses can educate Amelia to start preparing her for bedtime way ahead because routine activities help the sleeping patterns. Finally, nurses can educate Amelia to reserve 90 minutes before bedtime to relax and unwind.
The third nursing intervention is monitoring vital signs. Patients with hyperthyroidism present with a variety of symptoms, so it is always important to monitor patients' vital signs. Checking vital signs, which includes heart rate, temperature, blood pressure and respiration rate. It is found that hyperthyroidism causes rapid heart rate and increases the risk of abnormal heart rhythm. In relation to case scenario, Amelia showing a heart rate of 110, which is tachycardia. In addition to that, several studies have shown that hyperthyroidism leads to develop cardiovascular disease like atrial fibrillation and sudden cardiac arrest. So monitoring ECG and heart rate for Amelia is vital. As she has a fever, nurses should routinely take her temperature to check for infection because fever is a sign of infection. And it is described fever tends to be one of hallmark signs for thyroid storm. So it is better for Amelia to check fever frequently to see whether the fever is continuing or getting worse or the medication has reduced the temperature. From the research, it is noticed that if the hypothyroidism people is being untreated, then it can lead to thyroid storm. So, for the safer side, it is better check signs of thyroid storm on Amelia. The fourth nursing intervention is glucose monitoring for diabetes mellitus. Monitoring blood glucose level helps patient in maintaining a stable blood sugar level. Nurses should take Amelia's blood sugar level like before breakfast, before lunch or dinner, before bed, 2 hours after meal, or when she is feeling unwell. It is explored that if the patient diagnosed hyperthyroidism along with diabetes, then treatment options are more complex. So, referral to an endocrinologist would be a great idea for further evaluations. The fifth nursing intervention is smoking cessation. Smoking is a high risk factor for hyperthyroidism. It is noticed that the smoking effect of hyperthyroidism is more noticeable in women than in men. Research shows the evidence that the greater the number of packed cigarettes smoked, the greater the effect. So, Allied Health Team and nurses should encourage Amelia for quit smoking program and intervening her through 5 years program, where 5 years are ask, assess, advise, assist and arrange follow-up. And there are many coping strategies for quit smoking. And ask Amelia to try out like practice quitting, try a smoke-free day, and ask her to change the environment, use mind power. So nurses should encourage her to choose the best way to quit.
Moving on to pharmacological interventions. Appropriate treatment of hyperthyroidism depends on the underlying cause and often consists of combination of therapies, which includes anti-thyroid medications to reduce production of thyroid hormones and radioactive iodine and lastly surgery. In addition to this, beta blockers will help control hypothyroidism symptoms. The first drug we chose for Amelia is carbimazole. Generic name carbimazole, trade name NUR2106. Classification is anti-thyroid drug. Action: it works by inhibiting the production of thyroid hormone by blocking the organic binding of iodine, and it partially inhibits the conversion of T4 to T3 at the cellular level. Indication: hyperthyroidism, pre-thyroidectomy, before and after radioactive iodine. Contraindication: previous adverse reactions to carbimazole, serious pre-existing hematological condition, severe hepatic insufficiency and pregnancy. Side effects: nausea, mild GI upset, changes in taste, headache, thyroid suppression, agranulocytosis. Nursing consideration: when patient having the carbimazole, nurses should monitor cardiac parameters, observe for conversion to hypothyroidism, monitor for itching, rash, nausea, vomiting and granulocytosis, and instruct Amelia not to take any drugs which contains iodine, and also to instruct not to use decongestants for nasal stuffiness because they are poorly tolerated when they are having carbimazole. The second drug we chose for Amelia is propranolol, as it will provide relief to Amelia from her symptoms of palpitations and tremors. The trade name is Endocrine. Action: it is a beta blocker. It completely blocks beta receptor sites in the heart and kidneys, and it decreases heart rate, cardiac excitability and cardiac output. Indication: to treat angina, hypertension, cardiac arrhythmias, especially supraventricular tachycardia, and it is also used as an adjunctive therapy for symptomatic relief of hyperthyroidism. Contraindications: sinus bradycardia, atrioventricular block, cardiogenic shock, asthma or respiratory depression, pregnancy and breastfeeding. Precautions: cardiac failure history, renal or hepatic dysfunction. Adverse effects: bradycardia, fatigue, hypotension, gastric pain, nausea, vomiting and diarrhea. Nursing consideration: the nurses should monitor cardiac status, observe for bradycardia or decreased cardiac output, and also we should use this medicine with caution in patients with cardiac failure. The third drug we chose for Amelia is metformin hydrochloride, which is her current medication. Trade name Diabex, Diaformin, Glucomet. Action: it belongs to the group of bigonides. It improves glycemic control in type 2 diabetes by inhibiting the hepatic glucose production, gluconeogenesis, and improving sensitivity of peripheral tissue to insulin. Indication: type 2 diabetes. Contraindication: bigonide sensitivity, renal failure, congestive heart failure, acute or chronic metabolic acidosis. Radiologic studies involved iodinated contrast. Precautions: renal dysfunction, hepatic insufficiency. Adverse effects: gastrointestinal upset, metallic taste, nausea, diarrhea, and rarely it can cause lactic acidosis. Nursing consideration: while patient having metformin, the nurses should assess for allergy, monitor response to the drug, observe for signs and symptoms of hypoglycemic reactions. Administer metformin with meals to minimize gastrointestinal effects. Regular testing of blood glucose level. The fourth drug we chose for Amelia is Panadol, which is paracetamol. It is a simple analgesic and antipyretic. It is used for relief of pain as well as reduce fever. We chose this drug as Amelia's temperature is 38.4 degrees centigrade. It is important to treat her to reduce her temperature, as increased temperature can lead to thyroid storm. Indication of paracetamol is temporary relief of pain, discomfort associated with headache, including migraine or tension, and toothache, muscular ache, arthritis pain, and fever. Contraindication: hypersensitivity to paracetamol and use with caution in pregnancy and breastfeeding. Adverse effects. It has few adverse effects in normal dosage but occasionally can cause gastrointestinal upset. Very rarely it can cause thrombocytopenia, cutaneous hypersensitivity, which is including rash, severe skin reaction, bronchospasm and hepatotoxicity. Precaution, renal and hepatic dysfunction. Dosage, paracetamol 500 mg tablets, 2 500 mg of tablets orally every 4 to 6 hours. Nursing consideration, assess patient's temperature before giving paracetamol and assess. There are 10 NSQHS guidelines, many of which can be applied while treating Amelia. NSQHS standard number 4, which is medication safety, advises for safe prescribing, administering, monitoring of the medicine and minimize the medication errors.
NSQHS standard number 5 is patient identification and procedure matching, which aims at correctly identify all patients whenever care is provided and correctly match the patients to the intended treatment. The standard number 3 is preventing and controlling healthcare associated infections. The intention of standard number 3 is to minimize the risk to patients in acquiring preventable infections. In regards to Amelia, it is important to use the standard number 3 and standard number 5.